So the next section in chapter 5, we're going to pick up with celiac disease. So celiac disease is an autoimmune disease and can occur at any time in someone's life. It is more common in those who have other autoimmune diseases. For example, there's a very strong link between type 1 diabetes and celiac disease. But what happens is that protein gluten, which is in certain flours, causes damage to the intestinal mucosa, and then malabsorption occurs. So with that malabsorption, you can imagine we see the diarrhea, weight loss, anemia, and then several nutrient deficiencies. Remember back in chapter 3 in our digestive unit, we talked about those villi and microvilli. Basically, when gluten is introduced into the diet of an individual with celiac disease, it causes the flattening of those microvilli and villi. So we lose absorptive capacity. And so you can imagine that's why we see this anemia and nutrient deficiency, because we don't have those claws of that microvilli and villi enveloping those nutrients and bringing them into our bloodstream. So the treatment is basically a gluten-free diet. So that includes no wheat, rye, or barley. But what I do want you to take note of is that buckwheat, quinoa, and millet are okay. So this is written incorrectly here. The big ones are wheat, rye, barley, and then possibly oats. Oats in themselves are gluten-free, but if the oats are processed in a facility that also processes the rye, wheat, and barley, then which is quite common, then we see that as an offender. So some of the safe flours you'll have listed here, and you can include those 3 from the last slide: the buckwheat, quinoa, and millet, arrowroot, corn, potato, rice, soybean, amaranth, tapioca, sorghum, almond flour, coconut flour, bean flours. And when you're working with this population, you want to make sure that you're talking with them about reading the labels constantly. Because someone who has suffered with this disease for 10, 15 years, they might know that Heinz ketchup is always gluten-free. But when they buy a new bottle, they may not realize that Heinz ketchup just changed their formulation and it now has modified food starch, which could contain gluten. So it's important every time they're purchasing a new food item that they are indeed looking at the formulation and the ingredients. Next, we go to what I touched on last week is NPO. What this means is nothing per mouth. Okay, so the patient isn't getting anything at all. We want to make sure that we're monitoring the length of time that a patient would be considered NPO. Sometimes physicians will change a diet order to NPO and the person will just kind of linger on there, and we're going to be the advocates for the patients to step up and say, hey, they've been on this diet for far too long, or on this non-diet for far too long. It's typically used before or after surgeries and tests, maybe with severe nausea, vomiting, diarrhea. That's what that abbreviation stands for. And then this next slide just talks about the different progression diets, and you all did talked about that in your homework from last week. So we'll look a little more in depth into what those look like. So a clear liquid, that's outlined on page 112 and 113 in your text. This is not nutritionally adequate. So I want to highlight here, this is inadequate. Someone should not be on a clear liquid diet for a long length of time. Again, this would be similar to NPO, where they're using before or after surgeries or tests, or with nausea, vomiting, or diarrhea. And basically, a clear liquid diet is anything that would be clear at room temperature. So no dairy, but a broth, jello, some juices, coffee, teas, those would be fine on a clear liquid diet. You have a sample diet here on the next slide with a clear liquid. And then I don't know where my slide went for full liquid, but the full liquid would be the next step from the clear liquid, where the foods are liquid at room